H5N1, a highly pathogenic strain of avian influenza, bird flu, was first identified in 1961 in terns in South Africa. However, the virus gained significant attention in 1997 when it was detected in humans during an outbreak in Hong Kong. This outbreak marked the first time H5N1 was known to jump directly from birds to humans, leading to several cases of severe respiratory illness and fatalities. The 1997 Hong Kong outbreak led to the culling of approximately 1.5 million chickens to prevent further spread of the virus. Since then, H5N1 has become a global concern due to its potential to cause pandemics if it mutates to spread easily between humans. H5N1, or avian influenza, primarily infects humans through direct or indirect contact with infected birds. The virus is found in the saliva, nasal secretions, and feces of infected birds, so handling sick or dead birds is a major risk factor. Individuals can also be exposed to the virus by touching contaminated surfaces, such as bird cages, farm tools, or clothing that have come into contact with infected birds. In certain environments, particularly live bird markets or poultry farms, people may inhale aerosolized particles containing the virus, leading to infection. Although this transmission route is less common, it can occur in settings with poor hygiene practices. Consuming undercooked poultry or products derived from infected birds, like eggs, is another risk factor. However, proper cooking at safe temperatures effectively destroys the virus, minimizing the risk of infection through food. Human-to-human transmission of H5N1 is rare and generally limited. However, there have been isolated instances where close contact with an infected person, often in family or healthcare settings, led to transmission. To prevent infection, it is crucial to avoid contact with live poultry in affected regions, maintain good hygiene, and ensure that poultry products are fully cooked before consumption. H5N1, or avian influenza, presents symptoms that are often more severe than those of seasonal flu. Patients typically experience a high fever, which may be accompanied by a persistent cough and sore throat. Body aches and muscle pain are also common, giving it the initial appearance of flu-like symptoms. As the infection progresses, respiratory difficulties such as shortness of breath and labored breathing can develop, which can lead to more severe conditions like pneumonia or acute respiratory distress syndrome, ARDS. Gastrointestinal symptoms, such as diarrhea, may also occur in some cases, which is less typical of seasonal flu. In certain cases, patients may experience conjunctivitis, an eye infection causing red and irritated eyes. If untreated or severe, H5N1 can lead to complications such as multi-organ failure, making early medical intervention crucial. These symptoms tend to appear rapidly, with some patients deteriorating quickly, especially if the infection spreads to the lower respiratory tract. The treatment for H5N1 avian influenza focuses on a combination of antiviral medication and supportive care. Antiviral drugs such as oseltamivir, Tamiflu, or zanamivir, Relenza, are commonly used to inhibit the virus's replication. These medications are most effective when administered within the first 48 hours of symptom onset, although even later treatment can still provide benefits in severe cases by reducing the intensity of the illness and the risk of complications. In more severe cases, supportive care becomes essential, often requiring hospitalization. This may include oxygen therapy or mechanical ventilation, especially if complications such as pneumonia or acute respiratory distress syndrome, ARDS, develop. Ensuring the patient remains hydrated, managing secondary bacterial infections, and addressing any other complications are key aspects of this supportive care. For individuals exposed to the virus but not yet showing symptoms, antiviral prophylaxis might be recommended to prevent infection. Additionally, infected patients are often isolated to prevent the virus from spreading to others, especially in healthcare settings. Currently, there is no widely available vaccine for H5N1 in humans, though research is ongoing. Health organizations, including the World Health Organization, WHO, emphasize the importance of seeking early medical care for those exposed to the virus or showing symptoms.